Hi, everyone. Welcome back to The Checkup, CMH's new podcast. I have with me today Dr. Scott. Dr. Fred Scott's one of our general surgeons here at the hospital. Welcome.
Thank you.
So today, it is June. It is summer. We are enjoying these sunny days, but that brings with it a little bit of risk, and we're talking about skin cancer and sunscreen today. So tell me a little bit about what I need to worry about skin cancer-wise. I'm in my 40s. I'm still relatively young. But tell me what I need to be worried about.
Well, the one thing is that what your past has been like, because it's your past that gets you. They say if you've had a sunburn where your skin peels 3 times, then you're at risk.
Oh, boy.
Okay. Or if you've done a lot of tanning. Like you remember years ago, we had the Women's Health Fair, and,
Yes,
and there was that booth there that you could put your face in and you could see the sun damage.
I do
on your
remember
skin.
that,
Right?
yes.
Okay. So that's what puts you at risk. So then you watch for the signs of skin cancer. Like if you got, a black mole that's developing and it's changing. If you had a nice little round one, that's okay. But if it starts to change, there's what they call the A, B, C, D, E's of melanoma. And A is it's asymmetrical.
Okay.
B is the border's irregular. C is the color's changing. Like some melanomas will start out black, and then the black will go in. There'll be a white spot or a red spot in the middle of it. Mm-hmm. And then D, if the diameter is bigger than 6 millimeters, which is about the size of a number 2 pencil eraser.
Oh.
Okay. Then E, if it's elevating, if it's getting bigger or evolving. If it's evolving, like it looks nice and normal, but now something's running out the side and it's got a sore in the middle that doesn't heal, that's what you need to worry about. Some of the precancerous things, where you get these flaky, scaly stuff on your skin, they're kind of like, it's not like a mole, but it peels off and it keeps coming back and it peels off. Those are what they call an actinic or solar keratosis, where the sun's damaged and it's close to cancer, but it's not quite there yet. So that's when the dermatologist is your friend, because they can come in and freeze those, and that can prevent the cancer from developing. And then the dermatologist and some of the doctors, they got a magnifying glass, what's called dermoscopy, where they go around, they look at all your little moles and see if there's something to burn off or take off. Mm-hmm. I've had some people, they've had like little moles, and it's been the same for years and years, and then it starts to change. That's kind of what you want. Like I had a little spot here, and I thought it was just a scar from a pimple or something like that, and then it started to get a little sunk in the middle of it, like a little belly button. And that can be a sign of a carcinoid or basal cell carcinoma. So I took it off, and behold, that's what it was. And I was lots of risk, because when I was a kid, I was redhead. We were out playing in the sun in Oklahoma. One time I had on just my shorts playing on my grandmother's irrigation ditch, and we made a dam and all that. And I had so many blisters on my body, I couldn't put clothes on. And I used to golf, and I'd get sunburned enough that, you're sore and you can't do anything more. You wait a few days and then go back out and do it again.
Sure, great.
So now what they recommend is you wear a, wide brim hat.
Okay.
If you're going to go out and you're at risk for, sunburns and stuff like that, go in the morning or in the afternoon. But then, 11, 1, 2 in the afternoon, that's when the sun's coming down, that the rays are the worst for you. So then, wear your shady clothes, lots of sunscreen. The problem with sunscreen is people put it on and then they forget to reapply it. Even if it's waterproof and you get out and you sweat and you get out of the pool and you wipe your face off, you're wiping off the sunscreen with it. So you got to be reapply for it. They've got clothing now. There's a lot of different vendors that carry clothing that has a sunscreen built right into it. Mm-hmm. One of the first ones was called Solumbra. And on the top of the catalog, they'll show you, they do all these tests on people, volunteers. They take them out someplace, cut little sections of cloth out, and they put different sunscreens on them, and they do a grid on their back and see where the sunburn is and how quick it is. That type of
I would not want to volunteer for that. Yeah.
But they've got like hats for that. And there's some people, even if you're on certain medicines, you're more prone to have sun problems. So they've got a wide brim hat. They've got clothing that's cool, like this kind of stuff. It's ventilated. You can run marathons in it. They've also got stuff to cover your hands if you have problems with sunscreen. Some people can't tolerate the sunscreens. I got into that. It was several years ago when we took a scout troop down to the Bahamas. So I wore that stuff, and I had a surfing outfit that they put out. Then I put a regular, swimsuit on top of it. So I looked pretty nerdy, but I was the only one that didn't get sick from the sun. I got a little sunscreen burn one time where my pant leg came up a little bit above my sock. But other than that, it works pretty good.
So I've read or heard that if you're going to use sunscreen, you need a shot glass full or a couple ounces full?
An ounce.
An ounce
Mm-hmm.
every...
It depends. Depends on what the bottle says, but every couple 3 hours. If you're sweaty,
that's a lot of sunscreen.
It's a lot of sunscreen. Yeah.
Yeah. Mm-hmm. And so an ounce for your whole body, then for every couple. Yeah, that's a lot.
But if you wear the clothing, that cuts down on it.
Yeah.
And if you got the clothing that got the sun protective factor built right into it, then you just got your neck and your arms and your legs, whatever that type of thing.
because I can hear people now. If I'm just going to be outside mowing my grass for a couple hours, do I need to do all of that? I mean,
Particularly if it's in the sunny part of the day.
yeah, because I can just hear people now. Well, I'm just going out for a couple hours, right? You know, I'm just running to do whatever. I'm not going to the beach. Don't have to worry about it.
But the beach or even the ski resorts, most people are covered up at a ski resort. But out on the water, you get the sun from the sky, and you also get the reflection off the water too. And cloudy days are bad. You don't feel the sun, but the ultraviolet comes through, and you can get pretty good burns from that.
They have, I guess it must be weather apps. I don't know. My youngest has it on her phone where she always knows what the UV is. And she's probably looking for the wrong reasons because she wants to tan, but you can check that. I mean, there's apps where you can check the UV, but it's never safe to go without sunscreen.
You can go out for a few minutes, like in the morning and the afternoon. That's when the rays can hit you, and you've got enough UV to make vitamin D in your body. But not get a tan or not get a burn, that type of thing. But it's the direct sun, being out for a long time. You like the farmers,
right,
and stuff like that.
Yeah.
And the other thing is, the young women, they want to be tan because it looks so cool. But then if you look at a grandmother that tanned, look at her skin. She's all wrinkled up.
Oh yeah.
I do colonoscopies, and butts look pretty nice. They don't get burned much. They're nice, smooth skin. But you look at the rest of the body, they've been the sun.
I never thought about that, but yeah, I guess that's
you
probably
can tell
true.
the difference. Yeah.
Yeah, that's probably true. So what? You mentioned, let's say I'm going to go to the store and buy sunscreen. What I know, numbers go everywhere from 6 to 100. What do I need to be looking for in a sunscreen?
Well, some of this has changed recently. I don't think they've allowed to make 100% anymore.
Oh, really?
I think they say because it's not that accurate or something like that, because it doesn't last so long.
Kind of a false
So
sense of
usually the
security.
average is about 30. And it means is that if you put that on, it's going to protect you. It's going to take you 30 times. I think it's like 30 times as long to get a burn. If you get burned in 5 minutes, 30 times that, that's quite a while.
Yeah, that's a little bit of protection.
Yeah,
there,
so
right.
then based on that, then you need to reapply it. Does that make sense?
Yeah, it does. So
Okay.
if ordinarily
there's-
burning 35 minutes, it'd be 150 minutes.
Yeah.
So, that makes sense.
And then there's different ones. There's the UVA and there's UVB. There are different ones. And some of them they'll say you don't want to put on kids. This kid's skin can absorb what's in there. So there's kid-safe ones. Zinc oxide, people use that a lot. Like when I was growing up, that was the sunscreen. If you
white-
go around in your nose so your sun didn't get burned.
Yeah. So is 30 enough? I don't need to worry about...
If you reapply it. That's the trick, is reapplying it. Some people just put it on and they think I'm good for the day. Not necessarily.
Yeah. So I know there's a difference between mineral sunscreen and chemical sunscreen. Was one better than another?
I think they say the mineral is better because it blocks the sunscreen. It's not a chemical that gets absorbed in your skin. And I have, I've read some of those things, but I haven't done the research to back up, if you believe everything on the internet.
Yeah.
But some of those sunscreens can get absorbed, and that could be a problem. And I think that's why they don't want the kids to use it.
Yeah, and I know, like my daughter, the chemical breaks her skin itch, makes her break out. So she always goes with the mineral anyway. So I didn't know if there was really much difference. But
and then there's other ones like Neutrogena. If you got sensitive skin, they've got ones for sensitive skin.
It's a little bit of trial and error to figure out what works.
And there's also like people that get allergies. If you go to the allergen doctor, they'll do a test on you, like they do the skin prick test, and then they can give you a list of what you're allergic to. And then there's an app. It's called Skin Safe, I think is what it's called. And you can take that to the store and scan the barcodes on the products, and it'll tell you if that's safe for your skin or not. Like I got a big rash the doctor was treating me for, and it got worse and worse and worse. And they did that on me, and I've got a chemical that I'm allergic to. It's like a surfactant in a lot of soaps and shampoos and a lot of that stuff. And it's got 20 different names as a chemical. So it's hard to remember that. But if you use that, you can find what you're not allergic to. And that makes a big difference in your skin.
That's really pretty neat, though.
So if it looks like you got psoriasis or something like that, and maybe you really got an allergy to some of your skin products. That's
pretty cool. So, like on my typical day, I mean, I get in the car, I drive to work, spend most of my day in the office, I go home. I may be home, 4:35. I may spend a little bit of time outside, but not a lot. Do I need... Because I've seen things like talk about the internet. I've seen things on TV. You have to wear sunscreen every day. First thing you get up in the morning. Do I need that? Is it that a little overkill?
If you talk to the dermatologist, they'll say put on if you're putting on makeup, you can put on a product that's safe for your skin. That's got like an SPF like 10 or 15, something like that.
Yeah,
and that's enough just to kind of protect you when you're out for a few minutes. But if you're going to be out for a long time, then you really need to either protect your skin with a cloth, or the shade, or a product. If you're out on this water, you need something that's something on your skin, because you can't shade yourself from the sun reflected up pretty much.
Tell me a little bit. I know I have heard people say that skin cancer is, if you're going to have to get a cancer, that's what you want because it's more survivable. But that, whether that's true or not, is probably debatable to start with. But even so, it's still a pretty serious diagnosis.
Right.
Tell me a little bit about what skin cancer is and why people should take it seriously.
Well, like melanoma, I can give you an example. There was a patient that had melanoma on their scalp. They came in, their spouse had noticed a dark spot. So we biopsied it, came back melanoma, we took it out, and then sent them to get checked. And if you're on melanomas, you want to get a good margin so you know it hasn't spread yet. And then sometimes they'll do what's called a sentinel node biopsy. They'll go in, they'll inject a chemical or a dye or a radioactive compound that then goes to your lymph nodes, okay? And then they take out that first lymph node and see if the cancer spread there. Well, this person had just a little mole, and it was in June or July, and they died before Christmas. And they had tumors as big as your fist in their lungs. I had spread that fast. Melanoma it's wild. You'll see one or two, and then you'll see if it spreads, they'll do scans, and there's just tumors all over the body.
Really?
And it used to be, until a few years ago, they had a medicine that could make you sick like the flu. That was what they used, but it didn't really help. I mean, I saw people in their 30s die from melanoma, and particularly fair-skinned people, redheads and stuff like that. But now they've got these immunological agents that stimulate your immune system, and you'll see hundreds of tumors in somebody's body, and then in 6 months or a year, when you do the scan, it'll be hard to find one. So that's a big advance for
That's
melanoma.
amazing. Yeah.
But it will tend to come back after that. The other ones like basal cell, squamous cell, if you catch them early, that's pretty much it. But you've been exposed, so you're at risk. So then you need to, stick close to your doctor or your dermatologist to check and get them when they're small before they spread. Like I had one lady, she was mentally off a little bit, kind of a recluse. And she had one growing out of her, between her lip and her nose, looked like a horn. And I had another one that was big, that was bleeding over here. The reason they brought her to the hospital was because she was bleeding, needed a blood transfusion.
Oh, my
But she didn't
goodness.
want anybody to touch her. And then the next time I saw them when they came back to the hospital, the nose was gone and the upper lip was gone because that tumor just ate everything off. And so then you walk around with a Kleenex on your thing, or you look like Michael Jackson.
Yeah.
Kind of thing,
Yeah. Oh, my God.
And so that can ruin your looks pretty fast.
Well, yeah.
And, it can ruin your life pretty quick. Or if it spreads, some of those they can spread to other parts of the body. But most of them we catch them soon enough. But some people, 80% of stuff you have goes away. But the cancer that keeps growing bigger, you need to get in and get that taken care of.
Yeah. So if we talked about this sunscreen, but what the sunscreen and the sun protective clothing, those are all things that people can do. But how often do they need to be checking themselves for, like you mentioned, the moles?
I feel like about like once a month. You do a mammogram, self-exam once a month.
Right.
A guy should do a testicle exam to check for stuff. So about once a month. If you're married, get naked and look at each other. If there's something that looks suspicious, that's what it's, because a lot of the people that come in, the back cancers, it was a friend or
Somebody else saw it.
Or the barbers or the hairdressers, they'll see stuff on the scalp
Oh, I didn't
and on the
think
neck and stuff like that. So I've had a lot of patients come in that said, my hairdresser or my barber said that I need to get this looked at.
And then so if they have something that's suspicious, can they just go to their family doctor? Do they need to see a dermatologist?
You can go to the family doctor and they can help you decide if that's something to do. Some of them will, if it's the pre-cancer stuff, they can freeze them. They've got people in town that will do that. They can see one of us, the surgeons. If you've got a lot of stuff, if we've got a cancer and they recommend you go back in like 6 months to a year to recheck, make sure something's not coming back or it's not, you're getting more of them. And then depending on the cancer, it's like every 6 months for 2, 3, or 5 years. So you go back. But I see patients that are seeing their dermatologist on a regular basis, once to twice a year, but they'll come in because the dermatologist is full and they've got another spot.
Yeah.
So they want to take it off before it gets bigger and sees a dermatologist. Some of them grow really fast. Some of them grow really slow.
Okay, so our take home from this is wear sunscreen, wear a hat, and check yourself out once a month.
Right.
Right? Is there anything else that you want people to know or they should know when they...
If you've got a question, go see a healthcare provider.
Don't let that go.
Okay.
All right, that's a great thought to end on. Thank you so much. We appreciate your time today, and we'll have you back soon.
Okay.
All right, thanks.